Hello everyone, I'm Dr. Mridula V Amarnath, a consultant ophthalmologist. Today, the term black fungus has been heard a lot, especially during the second wave, and there's a lot of fear and panic among people. So I thought I'll share with you some simple tips and points. In case if it helps you in any way, I'll be more than happy. So what is this black fungus? Now this is a fungal infection that is caused by mucormycosis. Now, this is mainly found in the soil where there is dead vegetable matter, dead animal matter, or decayed rotten plants and leaves. Okay, so normally it is seen floating in the air. Under normal circumstances, where our body's immunity is strong, we are able to fight this infection. Even previously, mucormycosis was seen, but the incidence was extremely low then. So who all are at risk for this infection? Mainly, first is the immunocompromised individuals, those with a history of carcinomas, leukemias, or any renal disease or a liver disease. Those who've had a history of COVID, either previously or currently are having COVID infection, or overusage of steroids, immunomodulator drugs or antiviral drugs, and uncontrolled diabetes. Now, all these conditions definitely make the individual more prone to this mucormycosis infection. So now let me tell you how this works. The spores of the fungus, which like I said is found in the air, enters our nose. So when our immunity is strong, we are able to fight it out. But when our immunity is compromised, along with uncontrolled diabetes, it forms a perfect setting for this fungus to multiply and slowly start invading into the deeper tissues. Okay, so from the nose, it slowly invades and goes into the sinuses. From there, it gradually enters into the orbit and affects our eye. And sometimes it can even enter into our brain. So you must be wondering why this name black fungus. This is because this fungus is capable of invading into the blood vessels. Once it enters the blood vessels, it slowly starts forming clots. So the tissue surrounding that area does not get enough blood supply and slowly starts dying out. So in the early stages of the infection, if you look, the skin would be relatively normal. But over a period of time, what happens is it becomes red, swollen, and gradually becomes black or darkish in color because of the death of the tissues. So what are the symptoms that you really need to look out for? One, in the nose, you will have a stuffy nose along with a discharge that is usually blood-stained or blackish in color. Some of them might have a sinusitis kind of a headache, okay, which is usually one-sided. Along with that, they will also have a facial pain, a facial discomfort, which is usually one-sided, and a mild discoloration of the facial skin. Sometimes you can also have a blackish discoloration of the hard palate. Now, when it involves the eye, the patient will usually have bulging of the eyes along with drooping of the upper eyelids. Sometimes it can also affect your vision. There would be a decrease in the vision. The fungus slowly starts affecting the muscles of the eye and as well as the nerves that supply the muscles of the eye. So as a result, the movement of the eyes become restricted and the person will gradually start having a double vision. It can also affect the white color part of the eye, that is the conjunctiva, and the conjunctiva appears red and swollen. How do we manage this? So let me tell you one thing. Time is a very, very crucial factor in this condition. So as soon as you notice any of these above symptoms, immediately consult your ENT or an ophthalmologist. Fine. They would do a thorough assessment of the ears and eyes. After that, they would take a nasal swab, which would be sent for culture and staining to confirm the organism. A diagnostic nasal endoscopy would be done. An MRI of the brain, orbit, and the paranasal sinus would be taken to know the extent of the lesion. Along with that, your blood parameters and the renal parameters would also be assessed. So what is the treatment for mucormycosis? So as soon as the diagnosis is being confirmed, patient is immediately started on intravenous antifungal medication and along with a surgical debridement. Surgical debridement means the dead necrotic tissue is being removed out. Now this is done because this helps to prevent the further spread of the infection. Okay, so once the patient starts responding well to the intravenous antifungal medications as well as the tissue removal, then slowly the patient is being shifted to oral medications. The most commonly used antifungal medication for mucormycosis is amphotericin B, isavuconazole and posaconazole. So the next question would be, what is the outlook of the mucormycosis infection? Like I said, recovering from a mucormycosis infection greatly depends upon the early diagnosis and a timely management. Because like I said, this fungus can rapidly start spreading to different parts of our body. So if we start the treatment at the earliest, we can prevent the spread of this infection and help in the survival of the patient. So coming to the last and the most important part of this talk, how do you prevent this infection? So make sure you wear a mask while you're outdoors or while you're doing some gardening work or in your fields. If you have any wound, make sure it is bandaged till it is completely healed. If you're diabetic, make sure your sugars are completely under control. We have seen a lot of COVID patients who were previously diabetic have had a sudden rise in their sugar levels. And in fact, we've seen a lot of individuals who are not diabetic have currently now increased sugar levels. So make sure your sugar levels are completely under control. Next, do not self-medicate yourself. Do not start steroids or antibiotics by yourself, because these medications have to be taken at the right dose and for the right duration of time and under the supervision of a physician. So do not self-medicate yourself. Overusage of steroids is definitely not advisable. At the same time, maintain a good personal hygiene. Gargle your mouth with either betadine or with warm salt water. Even after you've recovered yourself from COVID, make sure you continue to do a steam inhalation at least daily once. So we've also noticed that some individuals after being discharged from the hospital need continuous oxygen therapy at home. So make sure you clean the water, change the water frequently, clean the humidifiers and the tubes at regular intervals. So what is the take-home message? So let me tell you, even after being discharged from the hospital, completely cured of COVID, or even if you don't have any symptoms of COVID, do not take things lightly. Because you've seen a lot of patients come back to us after almost a month with signs of mucormycosis infection. And this can affect any age group. So make sure you strictly follow all the protective measures that I've told you. Make sure your sugars are completely kept under control. Do not neglect the warning signs or symptoms. Immediately consult your ENT doctor or an ophthalmologist, because early management and initiation of treatment is the key for this disease. Thank you all. Take care. Stay safe.